Yes, everyone, welcome to the stream. Welcome to the chat. And today we're gonna be discussing about a very important topic. We're gonna be discussing about a very important topic, and the important topic will be headaches attributed to non-vascular disorders. Non-vascular disorders, which are let me check this. Yes, headaches attributed to non-vascular disorders, and non-vascular disorders are, we talk about. Let me repeat what we did. We talked about primary headaches. Now we are on the secondary headaches. Headaches that are being brought by something else. Headaches that are being brought by something else, and this something else. Hi, Jamaican uncle in the house. Welcome, Jamaican uncle. Big up every time. And it has been a while since yesterday I was not here. But all the same, God is good every time. God is good. So we want to talk about headaches attributed to something that is called non-vascular disorders. Vascular. What is vascular? Vasculars are blood supply, and blood supply is from the brain, and the arteries, the veins supply blood around the brain and the body. Those are called non-vascular disorders. They are called non-vascular disorders. So it is important to know there's some headaches that are attributed, that come. Blessings, Dr. Benjamin. I'm out making a lot of noise, so I'll be in the background. No worries, Jamaican uncle. Welcome, everyone. If you are new to the channel, man, if you are new to this channel, don't just swipe away. Hit the like button, subscribe. We're talking about headaches today, but the title is headaches attributed to non-vascular disorders. And I was explaining what non-vascular disorders are. Non-vascular disorders are, the veins, the arteries have their own problems that can cause you to have headaches. But here you get headaches that are not attributed to the complications of veins, arteries, and capillaries. And we will see what are these headaches, how do they come. If the arteries and the veins are well, and you are getting enough blood, what can be another problem that can give you headache? Yes, welcome, my friends. If you are watching from Africa, tell us to the chat. If you are watching from the United States, if you are watching from Asia, those continents around, tell us where we're watching from. Come and tell us, I'm watching from this and this state, and here from yes, uncle is saying please like the video as soon as you enter. Also subscribe if you did not subscribe. Welcome, everyone. If you're watching, please welcome, and hit the like button, my friend. Hit the like button and subscribe. I know many new people watch and they watch and swipe away, sometimes. But it's good to be around to learn some medical tips, some things that can, when you are feeling a headache, what you can do without taking some drugs, you be good. That is what we do here, learning about some proper medical tips, not just medical tips. We say proper medical tips. So who is here, who is watching me right now, where you are, the channel is called Benjamin the Wise Guy. I myself am Dr. Benjamin. And Dr. Benjamin is a person who loves everyone, a person who loves life, a person who loves talking to people, a person who loves everyone. Yes, positivity is the way to go, and keeping healthy is the way to go. We even talk about something that is called what? Mental health. And I usually say all problems start from here, then they get physical. So your mental health and brain health, there is a difference between mental health and brain health. So the process can give you some funny conditions that, like diabetes, hypertension, all those can be a problem. So you guys, my guy, I usually say you guy, my guy, if you are new to the channel, please don't just go. Don't just go. Stay around, listen, ask me a question. There are some good people at the chat there, ask them how they are doing. Relate with these people at the chat, my friends, relate with these people at the chat, and also make sure that subscribe. When you subscribe, it gives an impression to other people and say, this channel here, it gives us some good vibes. This channel gives us some good vibes. So don't fail to subscribe to this channel. If you are watching, don't fail to subscribe so that we can grow, me and you, and learn also. This is where we learn. This channel is where we learn and feel good. Learn and feel good. So everyone who will come in, everyone who is watching, wherever you are, be blessed. We're talking about headaches of non-vascular disorders. What are vasculars? Vasculars are blood vessels, vasculation, blood vessels and nerves, all those, the vasculars. And we have headaches that come because the blood vessels have problem and they are not delivering blood to the brain as per needed, or they are having a blockage and there is something that is causing you not to get enough oxygen to the brain. So what we are talking is the opposite of that. This is another thing whereby you have everything. The blood vessels are delivering blood, everything is okay, everything is perfect. But the only problem that you have is what? The only problem that you have is something that is called other issues that are coming in. Those other issues are the ones which we should get to know, those other issues. So welcome everyone. I can see more people joining and leaving and swiping, joining, leaving, coming back. Stay tuned as we discuss this topic, which is a topic of importance. Headaches attributed to non-vascular intracranial disorders refers to headaches caused by structural or pathological conditions, structural in the skull, that are not related to blood vessels disease. Blood vessels diseases like thrombosis, sclerosis, those things, the others that are not related. You can get such a stroke or aneurysms. These disorders increase pain by causing traction compression. These non-vascular disorders that are in your brain, you can have chronic headache in this way. They cause traction, or they compress. They compress the brain meninges, or they cause inflammation. And when there is nerves that are being compressed in your brain, you saw what comes out. Those mediators of inflammation, what makes you feel pain in the brain? What makes you feel pain in the brain? We talked about them. Gene receptor, calcitonin gene receptor peptide, substance P, and neurokinin A. They make you to have pain when the nerves release them, but they are helping in another way. They are causing pain. Obstruction of cerebrospinal fluid. Something can grow in between your brain and the way your cerebrospinal fluid goes around. CSF, your brain, there is a liquid that surrounds around, which is called CSF. It becomes a problem going on, or raised intracranial pressure. So if you block absorption of ICP, intracerebrospinal fluid, CSF, you will have something that is called cerebrospinal fluid. So according to the International Classification of Headache, ICHD-3, these headaches are classified as secondary to something, because there is something that is coming in and it is the one that is causing the headache, because they result from identifiable underlying condition. identifiable underlying condition. So, pathophysiology. The brain tissue itself lacks pain receptors. The brain tissue lacks pain receptors. Pain arises from stimulation of pain sensitivity structures such as the dura mater, large cerebral arteries, venous sinus, cranial nerves, especially cranial nerve number 5, trochlea, trigemina, number 9, and 10, vagus. And we say now, let me go through the cranial. Jayan, beautifully, let's play and feel beautifully. You see, your name just suggests what you are. Hey, Jayan, her name is called Jayan. Beauty slay. Let's slay and feel beautiful. So, my guys, we are here. We are talking about headaches, and there are some things. Today we are talking about headaches attributed to Yes, thank you, Benjamin. Welcome, Zayan. You look, even your profile pic. When you see your profile pic, this is a cute lady, and a cute lady who is kept herself in a good way. Welcome. Now, today we are talking about headaches that does not entail the blood vessels, the arteries, veins, and capillaries. We always have headaches because maybe oxygen is not getting, the blood vessels are not delivering oxygen per needed, or the mediators of inflammation that we talked about are being released. But now let me tell you one thing that is funny. One thing that is funny about headaches is this. What is this? One thing that is funny about headache is the brain itself does not have pain receptors. You get? The brain itself, your brain cannot feel pain. The white matter of the brain, Stan's Kitchen, welcome to the chat. You have said hi and I felt good. Said welcome, Stan's Kitchen, and everyone that is watching. No, I know some new people are watching and feeling, who is this guy talking here? This person that is talking is called Benjamin the Wise Guy, and Dr. Ben, the channel is called Benjamin the Wise Guy. My friends are here, Jayan, Jamaican Uncle, Stan's Kitchen, and then we have another person that I have never knew how to spell. Zidleaf, welcome. Mura Tidils. Where are you from? Oh, I'm from Kenya. I'm a doctor from Kenya, Murat. Which country are you from? Thank you, my friend. Welcome. Murat, which country are you from? Hope you have subscribed, Murat, and you stay here. Let's interact. If you are watching, come to the chat and tell us where you're watching from. Come to the chat, tell us I'm watching from this country. I like what you do. And which country is that? I am not good at flags. I'm not so good. Beirut or what? Driving now but listening. Thanks. Please be cautious driver. Yes, we want to preserve life. Thank you for tuning in. Thank you. It's a flag, it's a flag, Is it Beirut or is it where? No, that one is not Israel. Driving but listening. Thank you. So if you are a new guy, like Murat has come to the chat and has said that I come from this country, but that flag, I'm not sure which country is it. I'm thinking it's like Beirut or Istanbul. Yes, Istanbul. Murat, welcome. Subscribe to the channel. Murat, be around. We are talking about headaches today, and headaches that are attributed to no problem. Your head has everything perfect. Blood supply is okay. Those are called vasculars. Veins, capillaries, and arteries are okay, but Turkey, okay, that's nice. Please, I'm not good at flags. I didn't do history in high school, so I'm kind of like, so I know some other flags, but yes. So if you are new like Murat, come to the chat, interact with us, subscribe to the channel. Don't just leave without subscribing. Subscribe and be around. Interact with the people that are chatting, like Big Leaf, Stan's Kitchen, Jamaican Uncle, Jayan, The Beauty, Slay, all of them. Yes, of course. Yes. Now, I said one thing. The brain itself does not have brain receptors, which means the brain cannot make you feel pain. The brain cannot make you feel pain. What makes you feel pain is the other things. The other things that are involved around the brain. The other things that are involved around the brain are like nerves, blood vessels, venous sinus. When I'm saying venous sinus, it means the holes where the veins pass through. Meninges, periosteum. Periosteum is the skull itself, and cervical muscles and nerves from C1 to C3. Cervical muscles and nerves come from C1 to cervical 3. There is something here called an atlas. So the nerves that make people feel pain, a lot of them are cranial nerve number 5, trigeminal. Cranial nerve number 9, glossopharyngeal, the one that moves your taste and movement of your tongue. And cranial nerve number 10, vagus. They make you feel pain. This is why they make you feel pain. Welcome to our new friend, Murat. It sounds like how Marwa calls the boys at the village, Mura. It sounds like that. His name sounds like Murat ladies. Now, the brain tissue itself, we said, lacks pain receptors, so it can't feel pain. But the structure that are there can make you feel the pain. The structures themselves that can make you feel the pain. Guys, we are talking about secondary headache. So if you have any question that you feel it's a question of importance, you ask. You ask as we go slowly by slowly. The mechanism includes raised intracranial pressure. Just as how your blood pressure is, even the cranial pressure, the pressure in the cranium. This skull, inside is the brain, but inside the brain there is a lining where there is only fluid up to the spinal cord, and that fluid surrounds. So when that fluid pressure is so high, I will draw something so that we understand. When that fluid pressure is so high, it will make you have headache, and you will see why it will make you have headache. But people say my head is aching. I think my brain is not okay. Your brain cannot feel pain. Today you know that your brain cannot feel pain, and we will learn how your brain cannot feel pain. Now this is a man. I'm drawing a person's head. My markers, man. My markers are letting me down. Let me get the other one so that we can learn. So if you're coming in now and you have a question about headaches, headaches that are not brought by blood vessels, I'm here, man. I'm here for you. Just ask the question. Let's interact as I draw this structure here. This is not even a structure. This is a person's head. It's a person's head. Why are my markers going so dry? Is there something wrong going on here? My marks are going so dry. Use this one. Now the brain is here. And then we have the spinal cord. The brain stem and the spinal cord. I'm drawing something that I want people to see. It is very important. The thing that I'm drawing is very important. Very, very important. Very important. So that you can know. Look at this. This is your brain. So this brain has this is the brain part, and this is the spinal cord that goes down. So when you look at this diagram, how should I do it? I should put it this way. We'll put this way so that people can check it. So if you look at this brain, well, the green part is the cerebrospinal fluid that circulates. But this one is the brain, and this one is a diagram. It's just a diagram that shows what happens. See, so this diagram that shows what happens is a very important diagram. Why? Because when the brain produces the fluid that cushions the brain round, it continuously absorbs and it balances the pressure. You get? By absorbing and releasing. It's like a continuous way. Absorbing and releasing, absorbing and releasing. You see? So this absorbing and releasing, the absorption of this. See, this is a person. This is a good person. It's a person. So this person, when it releases and it absorbs and releases, you see, when it absorbs and releases, the pressure balances. The pressure does what? Balances inside the brain. But now there are some factors that can make the pressure inside here. You see the green part, the fluid is flowing around and it is cushioning it acts like a cushion to the brain and to the spinal cord so that it cannot be hurt. The brain cannot be hurt. You know, the brain is a matter that if it is hit, you lose focus. So it is cushioned on the fluid that helps it to be at the position. So if you go like this, it cannot bang against your skull. If you go like this, it cannot bang again. And it happens even to the spinal cord. The whole brain, the brain stem and the spinal cord. You see? So you are having a great day because your brain is not banging against the skull. You see? Great, eh? Guys, if you're coming in right now, ask your question. Just ask your question. Let's get to understand where you're coming from. And don't go without telling us which part of the world you're coming from. Subscribe and tell us which part of the... So we are talking about headaches. So things like raised intracranial pressure, the pressure that I've talked about inside here. Inside here, the pressure that I'm talking about, when it goes, you know, it will start to compress the brain. And what can happen so that the cerebrospinal fluid cannot be, the fluid here cannot be absorbed, blockages of some places that are out. Then the production can be high. So when the production is high and absorption is less, look at this. The production of the cerebrospinal fluid becomes so, your brain is producing a lot of CSF, cerebrospinal fluid, but the absorption is slow. What do you think will happen? The fluid will be more in the brain, so it will press the brain. And when it presses the brain, in turn, it is pressing against the cranial nerves. I've said the cranial nerve number 5, cranial nerve number 9, and cranial nerve number 10. Yeah? And when it presses against this, what will happen? You will start having problems with headaches. Why? I've said the brain does not cause headaches, because when nerves are excited, when you press nerves or irritate nerves, they release 3 things: calcitonin gene-related peptide, neurokinin A, and substance P. These are mediators of inflammation, and they start causing pain around your vasculars. The blood vessel starts to constrict or to dilate, and then you start feeling pain, because when blood vessels are dilating, what is happening? It is always causing pressure against the other, and that is how people get headaches. You see how people get headaches? That is how people get headaches. Direct compression of meninges. The meninges are the parts of the brain. So when you compress, you are compressing these blood vessels, and that's why today I'm sitting, just the picture behind me, circle of Willis. You see, this is how people get secondary headaches: inflammation, obstruction of CSF circulation, and hydrocephalus. We talked about hydrocephalus, and hydrocephalus is excessive cerebrospinal fluid. The fluid that is inside your brain is so much that even circulation is a problem. Check it out. Local tissue distraction. And what can cause this? What can cause this cerebrospinal fluid and inflammation inside this brain? Inside this brain not to work normal? There are some things that can cause, which are important to note. What are tumors? Tumors can cause a compression. Tumors can cause a brain stem somewhere to be compressed. Tumors are growths. If you're coming right now, my friends, if you're coming to the chat right now, hit the like button, subscribe to the chat, and let's interact. Let's get to know each other. Let's get to know everyone well. So there are some things like tumors. You have had some things like pituitary adenoma. Adenoma is something that is not spreading. It just grows where the pituitary gland in the brain is, and it compresses the pituitary gland. Brain metastasis. There are some people who get brain cancer and they start spreading inside your brain. These are called tumors. And these tumors may cause headaches. Why headaches occur? Why do headaches occur? Please share this very important live for many to take advantage of free lectures. Yes. Thank you, Stan's Kitchen, for this compliment. Thank you for this compliment. So, why headaches occur? Why do headaches occur when you have brain tumors? Why? Because now you are the brain. God balanced the brain as a human being in a way that everything balances itself. Greetings everyone, happy new month. That is Johnny Be Good, happy new month. At least today, Johnny B. Good have got some time to come online. Yesterday was crazy. I couldn't come online. So why headaches occur? If you have a brain tumor, a tumor is something that is growing inside your brain, and it progressively starts slowly as you get headaches. Progressively starts slowly as you get headaches. So what happens? What happens, my people? Because you have said the brain itself does not cause pain. The brain itself has no pain receptors. So tell me what happens. Let's learn. And but there are some things like these blood vessels here. Internal carotid artery, external carotid artery, rising up, going up. These vessels, posterior communicating artery, interior communicating artery, anterior cerebral artery, and then it forms circle of Willis. It's so hot here, I'm afraid to go outside. It's Canada birthday today. Oh, even Uncle has told me it's so hot today. It's very hot. Rehydrate, and if you know your skin is not it's not harder, you use creams, sunscreens. Don't get sunburns. So you are talking about something that is important, and this thing is the circle of use sunscreen. Yes, use sunscreens and rehydrate. Edema around tumor. Let me say this. Something is growing in your brain. Does prolactinoma give headaches? Yes. Prolactinoma gives headaches, my friend. That is a direct thing. Do you know of someone who has prolactinoma? Prolactinoma is a very common thing sometimes here where I am. But many people are misdiagnosed about prolactinoma. It will cause headaches because it produces prolactin. I'm talking in Swahili right now. It produces prolactin, and the physical growth pushes against the other, like blood vessels, it pushes against. And prolactinoma is a benign tumor. Benign tumor means it does not metastasize, it does not spread, but it grows. So it does not produce headaches because of prolactin production. Those are for yellow people. No, don't do that. It can happen to anyone. So it when it grows, it stretches, and it can injure a nerve, or it can compress a blood vessel. So let me draw something here. Let me go, like that. Now look at this picture that I drawn. This thing that is here red, when it is growing, it is causing a hole and compressing other vital organs. When it is growing and compressing other vital organs, now that is where problems start. It can obstruct somewhere, where the cerebrospinal fluid is being absorbed to balance the cerebrospinal intracranial pressure, the pressure inside your skull. So if it is blocking absorption and the CSF, the fluid is being produced, the pressure inside will be so high, and it will pressure the brain, and the brain in turn will pressure the blood vessels of the brain. And pressuring the blood vessels of the brain means that you have a problem. the inflammatory response will occur. Your body will start relieving things that can help you. One thing, now prostacyclin, prostaglandins, calcitonin gene related peptide from nerves, and then you start having headaches. And around the place that the edema, the place that something is growing, like our friend has said, Jayan has said, prolactinoma, which is an adenoma, something that is growing and it's not spreading, but it's just growing where it is. You get it? Where it is growing, it's not spreading in the body, but it is causing problems by compressing vital blood vessels, venous congestion. And sometimes your BP can go high because if it is compressing blood vessels, if this thing is compressing blood vessels, you will not get enough oxygen if needed around that place. So most of the time you'll get headaches. I'll go out later when they have fireworks. Oh, okay. Johnny Be Good, what is the time right now there? Here it is 5:20 p.m. What is the time where you are right now, Johnny Be Good? Fireworks, what time are they doing it? I think in the evening. They do fireworks at night. So, when now you have these features and you've seen, and let me say this, 10:20 in Canada. Oh, okay. That is good. 10:20 p.m. or a.m. Here it is p.m. 5:20 p.m. Let me say this. There is a headache in the morning. Nice. Here it is in the evening. Just imagine the difference. Imagine the difference in hours, Johnny Be Good. Well, that's a long one. So I saw my friend the General doing a clip. I saw the General doing a clip in Canada, alive, and it was so green. I think the General is in Canada. I think so, and it is so green, and people are complaining it's hot. God is amazing. So let's talk about clinical features. The first thing you should know is when you start having tumors in your brain and you are having progressive headaches, some things you should note about these headaches. There are some things you should note about these headaches, and these headaches occur in a funny way, and they start slightly because this, like prolactinoma, starts to grow, and when it starts to grow, it is small. But when it continues to grow to bigger, because it is gradual, there are those ones that grow so fast, and there are those ones that grow faster. Yes, but we lost all the leaves in the winter. Oh, okay. You see, so when it is growing gradually, it means that the force and compression is going on, and depending on where it is, like prolactinoma, we have said is a benign pituitary tumor. It is down there at the start inside. Sorry, it is somewhere here. Prolactinoma, because pituitary gland is around this area. Pituitary gland is around this area here. So as it grows, it gradually causes headaches. The bigger it becomes, so headaches that starts mild, and then after some time, like months or some weeks, you continuously have headaches that are so intense, you should do an MRI. You should do something that is called magnetic resonance imaging to check if there is something that is growing in your head, inside the brain, tumors. It is called progressive worsening headaches. From mild headache, after a week, it graduates to some headaches that are so throbbing. After a week, it graduates to some headaches that are going on and on and on. And mostly mostly worse in the morning. Worse in the morning. And I remember when we were at one live, Marcia Thompson told us that her headache starts in the morning. So those people that wake up with headaches in the morning, most people, let me say it so slowly, when you are waking up in the morning and you have a headache, I beg you please to be sure it is not to be sure that you are not having a complication. You know, it's good to get to know things early. It's good to know things earlier so that you can take important care about yourself. Do progressive MRI scans. Don't do one and say that everything is okay. Don't do one and say that I did an MRI and everything is fine, because it is progressive. A tumor grows gradually. So you may do the first one and it is negligible. It is there, but even the MRI machines cannot detect. But after some period, after like 6 months, but it depends with the kind of progression of your headache. After like 6 months, you go and do an MRI again, you will find a pimple. Something like a pimple. You get? And then you stay again, you go and do, you are now told now, and you will see the symptoms. So if you have been waking up with headaches, my friends, and progressively the headache is worsening, do something that is called an MRI progressively after 2 weeks, 2 months, 6 months, as per how the headache is progressing. So if it starts slowly, as you see the headache is progressing, every time you wake up you feel headaches, do it, because the early you get to know a problem, the better, because the ways of intervention there are good. So you see, sometimes when you cough, you feel your head. Why? Because cough reflex excites the brain meninges and the nerves. And when you cough, where the tumor is, it brushes against the blood vessels and you feel pain and even bleeding, because you are losing volume and the blood vessels are constricting. So you feel where the problem is. Marjay, greetings Dr. Benjamin and everyone. Greetings Marjay, how are you doing Marjay? Thanks a lot for your concern. When you are not online, when you have not seen me here, you usually ask, where is Benjamin? And you see that is brotherly, sisterly love. You always love your sister, you always love your brother, and you feel good. Just that social connection is enough to make someone know at least someone cares about you, you see. And it makes your mental health feel good. It makes your mental health relax. So those are things that you should look at. Coughing. When you are coughing and you're feeling headache, worse in the morning when you are waking up, you feel a worse type of headache. Progressive worsening headaches, it starts. And I've said, if you have a headache that is progressive, need to see a doctor to do an MRI, very important. Tumors can be managed early better than when it is bigger. Because when tumors in the brain are bigger, even some surgeries cannot happen. It may be killing you. Some headaches that come with nausea, vomiting, And then sometimes you just feel someone personality has changed. A person who has progressive headaches, and then one day this person just changes, starts to do some things like someone else. Just get to know there is something wrong going on in the headaches. Weakness and vision changes. Sorry about that. Weakness and vision changes. Because let's say African mom is here. Welcome, African mom. Today we are talking about headaches. Very good advice. Thanks a lot, Jayan. And that's why you are seeing today I'm easy, just talking slowly and slowly. Oh, I forgot. Scissors. You are having a headache until you get scissors, and then some people start saying you are epileptic. Nausea and vomiting. And then some ladies say, you know, when I'm getting to menses, sometimes I usually get these problems. Hey, take care. Guys, Fiona is here. Fiona, welcome to the chat. Thank you, Fiona, for tuning in. Fiona from Uganda. The next time I'll be in Uganda, I'll have to see Fiona. I'll have to say hi to Fiona. Very nice lady. A student of law. A student who don't like having shagala bagala. My friend Marwa says shagala bagala. Yes, enlightening us. Last week I had an headache with blood vision. Where? African mom, you had a headache with blood vision. Did you see a doctor? Question. Hello everyone in the chat. Hey my friend, Fiona is saying hello. Please say hello to our friend Fiona and support Fiona. Fiona is a lawyer, a law student in Uganda, and I like how she carries herself. She carries herself with three things: discipline, dignity, and integrity. That is what I see when I see Fiona, a young lady that carries herself with discipline, dignity, and integrity. So follow Fiona. If you go to Fiona's channel, follow her, support her on her studies, on her endeavors to be a lawyer in future. I can see Doc, my mom, when African mom, yes, I rushed to Coptic pressure manenas. I'm on medication. And Doc, my mom, when she eats something salty, she have headaches. Yes, when you eat something salty, you reduce your perfusion, volume of fluid. You know, sometimes when you eat salt, not all is absorbed. So your volume may go down, and then you start feeling blood volume because of retained water. I experience vomiting and nausea with my headaches. Nausea and vomiting with headaches. African mom. Let me start with African mom. If you have high BPs and you have headaches all the time that comes with blood vision, I when you're going to do your annual medical checkup, I advise you add on the annual medical checkup an MRI, a brain MRI. I strongly advise, because it is better to know that everything is okay, rather than ignoring, saying that it is only high blood pressure. And you know, as per every time I speak to people, what I say is, sometimes high blood pressure can be secondary to something else. You see, thank you so much. Coptic, I usually pass at Coptic at times when I'm going home, at Coptic, when I'm from the other side home. Now, T is here. T Beauty, a lady who makes me laugh every time. But I told T to be married in Kenya. T, have you got someone from Kenya? Now, welcome T. Thank you so much for tuning in, my good friend. We are talking about headaches, secondary headaches that are brought by problems that are not brought by what? Blood vessels, other things. So there is a question here. I experience vomiting and nausea with my headaches. Yes, nausea and vomiting. This one is called, if there is nothing else, because I remember Jayan, you had told me that you have done MRI, you have done everything is okay, and you are experiencing nausea and vomiting, and it is in the morning hours. If there is nothing else from everything that you've done, I will associate it with something that is called migraines. And not just migraines, we call it migraines with auras. And let me explain how it comes. Excitation of cranial nerve number 5, trigeminal nerve, that comes here from the brain and divides into 3. Oh, you also have prolactinoma. Okay, now I understand. The prolactinoma, it's an adenoma. The adenoma is pressing the pituitary gland, and in turn, trigeminal nerve, glossopharyngeal nerve. Glossopharyngeal is number 9, trigeminal is number 5, the nerve from the brain. And number 10, which is vagus nerve, they are producing something that is called calcitonin gene related peptide continuously, and the other one that is called substance P and neurokinin A. So you are getting auras. They are called auras because of these things. They are trying to balance. So Boniface Wamish, hi, how are you doing? Jian, J-Ann, Beauty Slay, are you on bromocriptine or cabergoline? These are the first treatment. It's usually dopamine agonist. Prolactinoma, the prolactin glands, they are the ones which produce to the mammary glands. They make you produce milk when you're breastfeeding. So for you to suppress this, you should be on a hormone that suppresses this adenoma, and those two are cabergoline and bromocriptine. On one of those, J-Ann. But now at least you understand how, I think you understand how the vomiting comes on. You see, cabergoline, yes, cabergoline is the first line, but you can also use something that is called bromocriptine. Bromocriptine, it's very important. And with time it suppresses or it stops from growing. You see, so when you get the symptoms are so much, you get rest. Take rest and continue using cabergoline. Cabergoline. So I've seen Boniface Wamish in the house. I've seen African Mom. I've seen J-Ann. Johnny Be Good is here, my friends. Thank you for tuning in. And if you have come here and you see the topic is so nice, so nice, share the topic to other people. Share this topic to other people, and also you do what you make them subscribe and like. There is something something I want to say, to tell J-Ann. Just a minute. There is something I want to tell J-Ann, which is very important. You know, sometimes this adenomas, like in the pituitary gland, the only thing that you can do is to wait and see. The drugs you use, they help to stop the adenoma from growing to a bigger one. There is something called immediate decompression of surrounding tissues. Because if it starts to grow, it will pressure them. And these are things that it's not growing anymore. If it is on suppression, that is nice. We only do something that is called watchful waiting. But for J-Ann, what I'll advise you, always be taking your prolactin levels. Your prolactin levels are very important. Thyroid function and adrenal function, adrenal glands from the kidneys, gonadal hormones and growth hormones. You know, for women, your gonadal hormones are estrogen, progesterone. There is something that is called progesterone will show how corpus luteum is, follicle stimulating hormone and gonadotropin hormone. You should be doing those generally. It is very important. J-Ann. Onik is in the house. Hi Onik, hope you are good. I've seen you as Onik is helping people out here and spreading the word about our talks, spreading the word about our unity. Thanks Onik for continuously doing that. T-Beauty, when are you coming to be married in Kenya? I told you you should be one. T-Beauty, I hope T-Beauty has a boyfriend in Kenya. Okay, now vomiting is not a good sign. It means that the compression has gone high. You get? So it's very important when you are on watchful waiting, like the one that I'm talking about, our friend J-Ann Beauty Slay, to be always, don't go for more than 6 months without a doctor's review. Don't go for more than 6 months. Guys, T-Beauty is trying to find one boyfriend in Kenya. Who is that? Who are there in this chat? Kenyan men. Doctor, how are you doing? I'm fine. Onik, you know I'm tied between working and coming online. So whatever time that I get when I'm not so busy, like right now it is 5:42 from 4:30, I usually come online. But imagine today I woke up at 3 a.m. and I'm still here, very strong, and I might go home late. I do check up twice a year. That is nice after 6 months. After 6 months. Onik is our funny friend. T-Beauty, let Doc help you to find one. T-Beauty, all my friends are doctors and health workers. If you need a doctor who is single, any suggestion here you should look for. T-Beauty, but it's telling you I help you. So, guys, that is about tumors. But there is something that is called hydrocephalus. In the chat, anyone who knows a condition that is called hydrocephalus, you may start just getting headaches that are coming. And people say that I'm always having headaches. When I go to do a test, everything is okay. Do anyone know something that is called hydrocephalus? Benjamin, perfect for me. Just kidding. I'm being sarcastic. Hey, I know it. African mom, you know hydrocephalus? Yes, even hydrocephalus people say is a disease of the children. It is a complication, not a disease, a complication of the children. It attacks even grown-ups. And let's go to know how it attacks grown-ups. And that's why I usually say, you rather spend money on diagnosis and investigations rather than on random treatments. Let's get to know why. Now, T-beauty, you'll get, if you get a doctor and you are the person who is not, you always want to go out in a date, you will be, you will feel like, no, this is not the life I wanted. Doctors are not good to date when you want to get into the relationship. And because we are always here, there, everywhere, every time. Oh, there is a friend of mine that is called Anytime, Anywhere. I know you'll come. We are always here, there, everywhere. So if you are a young man, you are a young girl, and you know you are outgoing and you are dating a medic, I'm sorry, you will be embarrassed at times, you will feel bad at times, but it's life. You see, it's life. You just take a look at me. At 3 a.m. you are up and you are getting to your house at 11 midnight, 12 midnight. If you are a young lady, a young man, and you're getting into a relationship, dating a dog, bad news. Now, look at this. This is a brain of a human being. Ale, greetings, doctor. I bless her. Thanks, Ale Wilson. African mom, it's true. Before I continue with hydrocephalus, let me give you a situation whereby the days I started dating, because I've been for some time on my marriage is yes. Yes, for some time. Let's talk about this before we go to hydrocephalus. It has stayed for some years, It's not less than 7. Yeah, it's not less than 7 and 8 years, So those days when we started, T-beauty, people are laughing at you. Those days when we started, there are problems. Because you are always in the world, you are always with patients, but someone needs time, But as time goes by, someone gets to understand, oh, I got married to a doctor. And this person I got married to is saving lives. And the time that this person realizes that time has gone, you are not a Gen Z anymore. You are not a Gen Z. And that is where culmination comes. Very funny, yes? Now let's talk about hydrocephalus. So you guys are beauty, T-beauty, some combination easy dog. Oh, African mom. The combination of a dog and a nurse is even worse. That one, it needs God's grace. That one needs, because most doctors are on duty always, and most nurses interchange the duties. Interchange duties, And I let me just tell everyone who is young out there and anyone who is having a relationship, enjoy your relationship while on your youth. Enjoy your relationship while you are young, while you are having that person, you are having time to move around, to go out for dinners, and to go out to smile, just relaxing near the river, looking at your person and feeling good without doing anything. When you start working like us, you are up and down everywhere. Children are up. You are building resources. You are trying this. You will not have that time to stay around the parks and the rivers to look at your person, how handsome or how beautiful that person is. So enjoy. And that's why I say, don't be promiscuous. Never date many people. You know why? Because when you date one person, this season of enjoying, understanding this person comes at a while. And then when it comes a season of serious business, now people are 30s, third floor, aggressively finding resources, aggressively going up and down, you are there, you are used to your person, you know what this person enjoys. But now when you date several people, you are a gully-gullies, you will be confused. Getting a person to marry will be a problem. So that is about life, Life is life and we should discuss life. So T-Beauty, enjoy life now. I hope God gives you a Kenyan good man. And I know you love enjoying life. So I hope God does not give a Kenyan good doctor out there. I want you to enjoy life. Now, let's continue. Let's proceed with our talk. If you are coming in right now and you have been out there, the topic is about headaches that are not produced by blood vessels. And I've said an important topic is, the brain does not have pain receptors. So the brain does not feel pain. The blood vessels, the nerves that are there, the ones which make you feel pain. So if you are coming right now, my friends, and you have not liked, check if you have hit the like button and you have subscribed. And you have subscribed. All my people here have subscribed. Big up to Onik, Johnny Be Good. I know Jamaican uncle is busy somewhere at a very noisy place, but he's here watching and going through, So hydrocephalus. How does hydrocephalus affect kids and grown-ups? And hydrocephalus is called excessive cerebrospinal fluid. You see this one. This is the brain, and this one is the spinal cord going down. So this fluid has a particular pressure that is supposed to be having. The brain absorbs the cerebrospinal fluid. The brain absorbs this fluid, and in turn it releases to balance that pressure. So if it is not absorbing as needed, what will happen? If it is not absorbing as needed, what will happen? The fluid will be produced and the pressure will be here so much. If you continue pumping fluid here, it means the pressure will be so high. And in turn, what will happen? If the pressure is so high, it is compressing the brain, and the brain is compressing the nerves, and then everything, even these blood vessels that you are seeing are being compressed. And when they are being compressed, there is something that happens. The nerves brings inflammatory response. These ones these veins and arteries bring inflammatory response. Prostacyclin, prostacyclin, calcitonin gene-related peptide, substance P, and neuroquinin A. When they are released, my friend, the pain that you will have in the head, because they are inflammatory mediators. They are inflammatory mediators. So you start feeling pain. And what can make you have this problem of the cerebrospinal, the fluid not getting into the brain as needed? What can make you? Congenital. Congenital means you are born with a problem. You are born with a problem. And that problem is making you not to absorb or produce the fluid as it is needed. And most of the time is your brain lacks the capacity to absorb the fluid so that it can balance. You see, most of the time that is the problem. Tumors. Something is growing at the area that the fluid is being absorbed so that it can come out when it's good. It's like a circle. So when you the tumor, like let's say this blocks, let's say this hand of mine, this is your brain, and here is where it absorbs the fluid and it comes out again. So a tumor starts to grow here, and this tumor like blocks. So the fluid is being produced and it is causing a lot of pressure. So a tumor is something that grows and it can block. Hemorrhage. These vessels can burst. Trauma, you can hit your head and it can burst. Let's continue, guys. If you have any question, let's talk about the questions you have. If you have any question, don't stay with your question. Let's interact. Let's come and say, let's interact. You know, any medical question. We are talking about headaches, but let's talk about any medical question. So, you see, the compression, when the CSF is high, it causes intracranial pressure. Inside your skull, too much fluid is produced until you have a lot of fluids inside and it is causing pressure. So the place that is called, the place that absorbs, it's called aqueduct. When you obstruct it, the fluid production goes high and the absorption less. So the intracranial pressure rises. So you have seen people with children that are born with big heads because the fluid was, when this baby was in the stomach, you know, the brain was soft. So the fluid was so much until it was pushing the brain. That's why those children are born with big heads. Sorry. That's why those children are born with big heads. You get? So that is how hydrocephalus makes you to have headache, because it is compressive. When you have hemorrhage, one of these blood vessels have got an injury and you are bleeding from inside, what can happen, my friends? It will cause a clot. A clot can make the aqueduct to block, and then you will start having headache. You may lose vision. And losing vision means here, the front, there is a problem. At the prefrontal cortex, there is a problem. Yeah, because the optic nerve is it's just up the olfactory. And when you lose sense of smell, just know the olfactory nerve of the smell here, because the first cranial nerve is olfactory. Then we go to optic, oculomotor, trochlear, trigeminal. Oculomotor, trochlear, these ones are for the eye. Then 5 is for sensation of the face plus eating, and then 6 is for the eye. So 3, 4, and 6 for the eye. They help the eye. 7, facial, taste. See, facial. 8, glossal. 9 is glossopharyngeal. You see, so that is how we get to know there is a problem somewhere. There is a problem with this person somewhere. So the obstruction is 8 is for when you have a problem with hearing. Cooking with Kemisha is here. Cooking with Kemisha, welcome to the chat. So this is how we get to know where the problem is. And you have seen African mom has said she had a problem until she had vision loss, because it was high blood pressure with compression of the optic nerve. That's why you vomit and then you lose vision, because just before the it is called prefrontal cortex, there is the optic nerve. So it was compressed as the pressure was going up. As the pressure was going up, there was compression. You see? So that is it about hydrocephalus. Infections can cause you to have hydrocephalus. As a grown person, you get meningitis. Meningitis is inflammation of the brain meninges. So the colonies of bacteria, they eat where the cerebrospinal fluid is being absorbed, and you are a grown up. And then what happens? You start having, because now your skull is not like a kid's skull, it is tough. What you will have is persistent headaches, because the fluid is excess and it is pushing. That is where you see, you've heard of some doctors, when you go and you have that thing, hydrocephalus, as a grown up, they, to save your life, they just drill a hole so that more fluid can come out, and immediately it comes out, you see this person regaining conscious. After you do that, this is where you start planning. This is where you start planning now for surgery, and urgent surgery. You have saved life, because the fluid was piling out. So from today, just know hydrocephalus is not for children alone. Even grown-ups can get, and grown-ups can get after an infection and hemorrhage, blood being flowing from your head after an injury, a clot formation, and it is blocking where the fluid is being. So children, they are born with hydrocephalus. They are born with big heads. Why? Because the head is soft. So as the fluid, it's called congenital, born with. There is a problem with the area where the cerebrospinal fluid is being absorbed. So because it is soft, as the fluid pile up, the head becomes bigger. And that's why you have seen that most children that have hydrocephalus, they are born with heads that are big. So when you are born, if surgery can help, well and good. And there are some drugs you are given, of course, to help you as a child. But for a grown-up, the most common sign is seizures, headaches that come. You've got meningitis, and then an infection colony has blocked the area where the fluids are absorbed. You've got a head injury, and then you get internal bleeding from the, let's say, posterior communicating artery or anterior communicating artery of the circle of Willis. And then in the brain meninges, the clot blocks where the cerebrospinal fluid is absorbed. You will not have a big head as a grown-up, no. You will not have a big head. What you will have is headaches that are really severe and persistent. And that's why I said, when you come to a hospital with severe headaches, big up every time to Boss Ben. Greetings from work office. I listen in the background. Thanks a lot, Michael N. Thanks for tuning in. Blessings every time. So when you go to a hospital and you meet doctor, I look at you. Your vision has gone. I look at you. You cannot even speak, and you are just holding your head. The first thing I say is, take this person immediately to an MRI machine. Go and get an MRI machine. When you come, the radiologist says, Dr. Ben, your patient has a lot of massive CSF. What do you think I'll do? I will not wait until we do surgery. No. I have to relieve and do a borehole immediately, you see, and then relieve the pressure so that the nerves cannot continue being compressed. And as I'm doing that, we are talking as a team very faster, talking to neurosurgeons, telling them this is a very important surgery. Please, let's do it to remove this clot. Let's do it to remove so that we can save this life. The first step of save life is to relieve the pressure. And African mom says, these are serious issues, doc. So this issue of headaches, mara moja, Panadol, over-the-counter and medication can land us in deep problems. Plan a day for this. I usually talk about it, but it is important. I think African mom world, we should, before we continue with other types of headaches, whatever that we have talked about is very important. Over-the-counter medication with progressive headaches, we should do that first. You see? So, thank you for reminding me, African mom. That one is very important. That one is very important because you remember, let me read what African mom has said again. African mom has said, these are serious issues, Daktari, doc. So these issues of headaches, mara moja, Panadol, over-the-counter medication can lead us in deep problem. Plan a day for this. And a day, I'm not planning, it is tomorrow. Tomorrow at 16:30, that is what we will be doing. Guys, you are persistently taking painkillers. Most painkillers are called non-steroidal anti-inflammatory drugs. They are metabolized in the liver and excreted in the kidney. The more you take them, they are destroying your liver while destroying your kidney. Let's talk about it tomorrow. I will talk about it tomorrow. Very important. Now, where were we on this topic? We were at adults with headaches with hydrocephalus. So when you get to a hospital, and I want to talk to everyone who is listening, and it is late, you know, you have had some doctors have been taken to court because of doing some procedures without consent. We are human beings too, and we would love to save life. Give this scenario. Your patient has come to hospital without any relative, a headache, and then this patient has been rushed to an MRI. She comes, and maybe this patient came to hospital. What I see is hydrocephalus secondary to meningitis or secondary to trauma. Maybe this person hit the head traumatically and a concussion brought up and it blocked. So me as a doctor, I decide to saving lives, this person has 2 hours to live. Let me do a borehole. At least by the time the relatives will come, I relieve the pressure first, regain conscious, and by the time the relatives will come, we will discuss about the surgery now. The real surgery, you know, the first one is, so when the relatives come, we have done the borehole, we have recovered the person, but this person is in ICU. They start telling you that we did not tell you to do it. Who authorized? Now our person is in ICU. Our person cannot even talk. Our person came himself or herself in the hospital. You know, sometimes it's good to listen, and like now we are getting sensitization, and through this sensitization we will know how to work out. And that's why you have heard sometimes, and this is important, you've heard always, and people say that he or she was just well with a headache, went to hospital, but right now the person is in ICU. We want to sue the doctor because there is something bad that the doctor did. You know, when you are not sensitized, you will feel like the doctor destroyed your relative so bad. But now you, as a good person, you have come to my channel, you have sensitized you, and you know about headaches. You know now how you are feeling now when you are getting the information. You can help a neighbor, you can help someone else at home by thinking and not causing chaos when someone is, because some frustrations of doctors is when you are trying to help and you are being thrown stones. You know you did the best. This person is in ICU as you talk about and discussing, but the relatives, because they are green and they don't know anything, they start being advised by crook lawyers, relatives out there that don't know. So this is how things happen. So right today you have known that even grown-ups can get hydrocephalus. Yes, doctor, thank you very much for the knowledge. It's important. Thank you so much for acknowledgement too. Knowledge and acknowledgement. So you now have known these headaches that you get, your blood pressures go high, they are persistent, you can't even see. And then you go to hospital, you are told you have meningitis with knuckle rigidity. Knuckle rigidity is when you can't push your head right or left. It may not just be headache. So, my opinion as a doctor wants you to do several tests, even if you are using your finances. It is better to use your finances to doing those tests and narrow down to the cause rather than going direct to treatment randomly without knowing the cause. Because some people complain that the doctor have asked very many tests. Are they even necessary? Even if some are not necessary, you may get that the one that you think is not necessary is the one that has brought the diagnosis. You see? So this is just headache we are talking about. Headaches. Imagine, we're just talking about headaches. We haven't talked about other problems that we are going. So let's talk about severe symptoms of hydrocephalus. Hydrocephalus, when the aqueduct is blocked, the headache becomes so bad. You get morning headaches when you wake up, vomiting, vision loss, because now the pressure is high at the brain and it's compressing the skull. Papilloedema, the eye, and reduced consciousness. There is something that I wanted to talk about, but I will not talk about it today. I will talk about it maybe tomorrow after we talk about over-the-counters and others. I will talk about, or I can talk about it at night if I get time. I can talk about it. That is called idiopathic intracranial hypertension. Hypertension is not just your blood pressure. No, I've said even the cerebrospinal fluid has hypertension of its own. So when I say idiopathic, I mean unknown intracranial hypertension. You don't know, but we will see how it comes. You don't know what is bringing this thing, but we will see how it comes. Idiopathic, we don't know how it comes. For today, we have talked about the topic of unknown, like tumors, how they come. And we have exchanged some ideas that are very important when it comes to managing headaches. So friends, if you are watching, I hope you have learned something. And if you have a question, let's ask like 5 minutes before let's ask the questions. Let me give 5 minutes before I leave, so that maybe someone had a question and I'm here just rushing to leave. Let me ask a question. I'm seeing so many questions I've not answered. I wish I had 2 sessions like the other times that we had a session at 16:30 and then we have another session at night. Nowadays things have become tough on my side. Very tough on my side. So anyone with any question, my friends, or something to say before we go, But we have said that Our Lady T Beauty will be married in Kenya very soon. Very soon be married to Kenya. Yes, and everyone. So you've seen about it, and the most important thing you should know is when you wake up with headaches in the morning. When you wake up with headaches in the morning, for me as a doctor, it's a red flag. But when you come home with headaches in the evening, for me it's okay, because through the day there are so many things that people face and go through out here. There are so many things that people face and go out here on. So going at home in the evening with a headache, it's okay. It may be work, it may be maybe you have not eaten, but you see in the morning says there is something that is happening in your body. So it's important to check. It's important to go to a doctor and tell the doctor, why am I waking up with headaches in the morning? The doctor will do some tests, that's just like I've said, and will give guidance accordingly. And the doctor will give guidance accordingly. You see, because this headache that we are talking about, these are secondary headaches that are being brought by something else. Headaches that are being brought secondary to something. So anyone with any question, my friends, or parting shot, we have questions and we have some things that are called parting shots. Parting shots. Parting shots are things that you acknowledge someone after a class. But in medical classes, when I was in medical classes, it was heavy. Parting shots were not there. You come from a class, your head is bigger than how it came in. Medical classes are no joke. So if your son, your daughter, and your relative is in medical school, and sometimes he just comes home, and what this person the first day he does is sleeping throughout, give guidance. It's called mental talk. Give guidance. Johnny B. Good is asking for some music. Today is on Wednesday. Today is not good for music. We are waiting for Friday. Friday we usually have Feel Good Friday. Feel Good Friday on Friday. So that is the day that we usually jump and shout, scream out loud. Don't forget about tomorrow. Jump and shout, say scream out loud. Yes. We have a jump like warriors. That is a Kenyan song from a musician called Naziz. It is a very old song. So I can see Michael N today has been here. Michael N, thank you for your support, man. Thank you for coming in. And it's been long I haven't seen you around, but I thank God you are doing good. When you see your friend on your chat, you thank God. Like yesterday I saw Elaine Pudiau on Marwa's chat. I have not seen her for so long, and I was just happy to see her commenting. You see, someone is there and doing good. Johnny Be Good, thank you so much. Margie and Jamaican uncle, we have just talked. You are busy somewhere. T Beauty, I will find you a doctor so that you get the real situation of being married to a doctor. Cooking with Kemisha, welcome and thank you so much. African Mom, big up yourself. Onik was here. Everyone that was here, acknowledgements. Ale Wilson, here, listening up. You see, all of you that have been watching, bless up every time. And you have seen, I'm still receiving messages, people asking me Why are you putting some videos we cannot watch? My guys, man, there are some videos, we talk, we learn here, but the members of the channel have their exclusive plans there, some private videos for myself, some far good videos there, but when it comes to the normal learning, we should learn, all of us. Hey dog, Jesse, welcome. Jesse from Mombasa, Kenya, the lady of the coast. Welcome to the channel. So I'm explaining it. When someone has given joined your channel, like this person is a member, this person gets the exclusive parts of some more, and some things, of course, you cannot put on public because they are for members. So if you see members only, just hit the button and join and watch them. And people that watch members only are supporters, those people that really support you. So thanks a lot for even watching and supporting and making me come out for this those hours that you watch. They count. They count a lot. The spirit of coming online and making me come here and talk, it gives me a diverse social life. You got a diverse social life, and I'm learning, and even me, I'm learning, because when sometimes we socialize here, I give a topic and someone says something. I usually say I don't speak on what I don't know. If someone says something, I usually go and do some research on that thing. I've done many things that, we are people we meet here, we are worldwide, and we come with different issues, different views. So when I get the different views, what I usually do, whatever that I don't understand, I usually go and research, and it makes me better of a doctor, you see. So thanks for everyone who comes and gives me some views and support, and God will bless you too. So for now, it is 6:21. We have talked more than 1.5 hours about headaches, secondary headaches. So if you are watching and you are here, if you have not liked as we part, hit the like button and share the video. And for now, let me say bye till tomorrow, or at night if I get time. See you and be blessed where you are. May God bless you. I've been down by the river, waiting for the new life to pass my way. Oh yes, see me say I'm